Well, hello everybody. It's Dr. Chris Lauria from Roanoke Knee Solutions. It's been a while. Few things have been going on, been pretty busy. Been unable to do any of these Facebook Lives recently, but I wanted to check in tonight. I've been getting, just a lot of comments, a lot of questions via Facebook and the advertising and social media and from patients about the knee laser program. And one of the biggest questions that comes up, and it's constant, is can the laser help bone on bone knee pain? And I want to handle that tonight. I'm just going to give everybody a couple more minutes because I write a lot of answers to people. Hopefully, they're able to understand what I'm saying. But tonight, we're going to handle that question and talk about bone on bone knee pain, what it actually is, and why I tell people you're not an immediately disqualifier for laser treatment if you do have a bone on bone situation. So we'll give everybody just 2 or 3 more minutes here to check in. I see some people checking in here now, so that's a good thing. Appreciate everybody coming out. Beautiful day here in Roanoke. 80 degrees when I was driving home this evening. So hopefully winter's gone and we can move ahead. So let's spend a second here talking about bone on bone. Let's talk about the knee joint first so you'll understand this. This is a model of a knee. You're looking at it from the front. Um, in the front of the knee, you have a kneecap, and then you've got an inside joint space called the medial and an outside joint space called the lateral. So the knee is what's called the tri-compartment joint. It's designed like that because it's got to take a lot of weird stresses and turns. These joints are fluid-filled cartilaginous sacs, and they act. The joint is actually a shock absorber that allows good motion and movement. The joint can degenerate. It can break down due to injuries, traumas, accidents, sports injuries, poor posture, structural problems can all cause the joints to wear out. When we look at these joints and the way they wear out in blue here, there can be mild degeneration, moderate degeneration, severe degeneration, where the joint's getting thinner and thinner. And then there could be what's called marked degeneration. And when there's marked degeneration, there's no joint space at all. That is a true bone on bone situation where there's the bone is touching the other bone on the other side. You've got the tibia at the top, the tibia at the bottom, the femur at the top that make up this joint. And those two bones are actually touching each other, and there's no kind of joint space articulation there at all. And that's a true bone on bone situation. First of all, I hear when people come in the office, a lot of people say, I'm bone on bone. And that can mean a bunch of different things. There is not a whole lot of true, complete bone on bone situations. I think I maybe had one or two since we've been doing these in the office. And the key is when someone says if you can help bone on bone, it depends. Okay. If it's a complete bone on bone situation where the medial joint space, lateral joint space, and the patella have no joint space at all, it's a true bone on bone situation in all three joint spaces. No, chances are we can't do anything to relieve that pain. But there's not many cases that have that. Some people have partial medial bone on bone, partial lateral. They could have bone on bone in the kneecap, and the other joint spaces are in bone on bone. If it's not complete bone on bone situation, laser can help give these people relief. Now, what laser does, it sends laser waves into the joint. It causes a response where red blood cells rush to the area, and that helps cut down on inflammation, irritation, swelling, pain. It can stimulate stem cells within the joint to relubricate and sense degenerated joint space. Well, the areas that there's bone on bone, it's not going to relubricate, but is able to give these people tremendous amount of relief from the symptoms they're having due to the tremendous degenerative condition they have in their knees. Now, what we get in a lot of cases is people who have bone on bone articulation or bone on bone situation in their knee, and they're not able to get knee replacement. Maybe their body mass index is too high. Maybe they have heart. Someone today who came out in heart condition and she couldn't get knee replacement surgery. Uh, Diabetes. There's many things that can prevent you from getting a knee replacement if you don't need it. And some of these people do have bone on bone situation. Again, if it's not completely bone on bone all the way around, laser can give you relief and help your symptoms. decreasing. Some people can get up to an 85% decrease in pain with the laser treatment. And it's effective. It's more long lasting than a shot. Cortisone shots can give you injections too. The problem is you can't get too many of them, and they can't give you a shot really in all three joint spaces. The other thing is long-term use of, cortisone can degenerate the joint even more in the bones. Um, so that, that's a negative effect of too many of those over time. Plus, steroids have side effects too. So, to answer your question, can it help bone on bone? When I say it depends, okay? Um, it's not an immediate disqualifier. What we'll do is examine you, do a complete exam of the knee, review the x-rays, okay, to see if it's a complete on bone situation. If all three joint spaces are effective, I'm not going to be able to accept you because the laser is not going to be able to overcome that. But if any of those other situations arise, it's partial bone on bone, it's one joint space, it's bone on bone, uh, then the laser is able to give these people relief, better function. Now, with someone who's in this type of situation, you'll reach a level of improvement, and then you'll probably have to maintain it at some level with that, with some maintenance type laser treatment. The amount of treatments it takes depends on, again, how severe the degeneration is, which joints are affected, and those type of things. So those are all things we handle in our initial consultation, where we actually go over um, these type of things to determine, number one, if you're a candidate for the knee pain program, and then how many treatments that you would need in order to get corrected. So there's no charge for that complimentary consultation where we'll spend time sitting and go over what I found. So hopefully that answered your question. If you have any other questions, you can reach out to me. You can email me at info@roanokedisccenter.com. If you're interested in setting up a consultation, you can see the ticker down below. You call us at 540-210-1445. We'll set up that consultation. You and I will meet and do that exam, review of x-rays, and talk about what we can do for your bone on bone knee pain. Okay. So hope you're having a great evening. Enjoy this weather. Hopefully we'll be on again next week to answer some more questions. Keep sending them in because I love having something to talk about each week. Okay, and it's Dr. Chris Lauria from Roanoke Knee Solutions. Have a good evening.